As you can probably guess from the pharmacy sitting here in front of me, we are officially in it. 2026 spring allergy season. Much of the US is seeing record high pollen levels right now, a mix of tree and early grass pollen that is making life miserable for 81 million people across the country. So if you feel like everyone around you is sneezing, you're right and you're not alone. Here's the thing though, most people treat allergies with the spray and pray method. They grab whatever's on sale and hope it works. Today, we're changing that. This is part 1 of our Minimalist Clinician series on allergies. Today, we're mastering the meds, over-the-counter, and prescription. Next week, in part 2, we'll dive into the science-backed natural remedies and the fascinating link between your gut, nutrition, and your nose. Before we talk about how to stop allergies, we have to understand why your body is doing this. It's actually a 2-step process: sensitization and reaction. Step 1 is the learning phase. The first time you breathe in pollen, your immune system mistakenly identifies it as a threat. It creates specialized IgE antibodies that arm your mast cells. You don't feel a thing during this phase. Step 2 is the overreaction phase. The next time you encounter that pollen, it binds to those preloaded IgE antibodies, and those armed mast cells explode, releasing histamine and inflammatory chemicals. Within minutes, you're sneezing, itchy, your nose is running. This is the early phase. Then hours later, the late phase kicks in, leading you to deep, heavy congestion. A simple way to think about this: your immune system is like a high-tech home security system that has been programmed to sound the alarm for a leaf blowing past a motion sensor. The system isn't weak, it's just not optimally programmed. So why is that programming out of whack for some of us? Well, it's a mix of genetics and environment. Family history is the strongest predictor. We call this the atopic march. It often starts with eczema in infancy, then moves to food allergies, then allergic rhinitis, and finally asthma. So a child with one atopic parent has increased risk of also developing atopic conditions, while having 2 atopic parents increases that risk substantially. Interestingly, things like early exposure to pets, especially dogs, breastfeeding, and rural living all are protective. On the flip side, urban living and early antibiotic use can increase risk. This is the hygiene hypothesis. Our immune systems need a little dirt early on to learn how to tolerate the world. So do allergies change or get better over time? Maybe. Allergies often peak in your 20s and 40s and then actually improve as you age. Overall, IgE levels decline over time. But here's the catch. Even if your internal sensitivity is stable, the world is changing. Climate change has lengthened the North American pollen season by about 20 days over the last 30 years, in addition to increased pollen counts. So even if your body is technically less allergic, the season feels worse because the pollen is hitting harder and longer. So how do we manage hay fever and its associated symptoms? If you have moderate to severe allergies, nasal steroids are your first-line defense, as they are highly effective at reducing nasal inflammation. Think of nasal steroid sprays as fire prevention, not a fire extinguisher. By starting them early, you're coating the nasal lining and stopping inflammatory cells from ever moving in. These are the available over-the-counter options. And a couple of important notes: studies have shown significant improvement in symptoms if started 4 weeks before the pollen season. On that side note, you can track pollen counts and forecasts through various apps and websites, but the gold standard resource is the NAB. I've posted that link in the comment section below. When you're spraying, remember, don't aim for the middle. You want to avoid the bridge of your nose or the septum, that center wall, as that can lead to irritation and nosebleeds. Point the tip slightly outward toward your ear, give a gentle sniff as you spray, and you'll get the medicine right into the nasal passages. Most trials use morning dosing, but some chronobiology studies suggest early evening might be better for your nasal circadian clock. The most important rule though, consistency. Use it daily whenever you can remember, as long as you're trying it for at least 2 weeks to see if it works for you. Second-generation oral antihistamines are recommended as first-line treatment for those who suffer from intermittent allergy-related symptoms, because these can be used as needed for those rougher days. This is because oral antihistamines have a rapid onset of action, about 30 to 90 minutes, and are still effective when used as needed. So starting before the peak season is not usually necessary. But if you suffer from more severe or persistent allergic rhinitis, daily use provides better anti-inflammatory effects. Now, if you've been taking the same antihistamine for months, you've probably been given the advice to rotate or switch to a different oral antihistamine for better efficacy. This popular advice is actually not evidence-based, although in clinical practice you will hear us all say this. The better approach, if you notice your antihistamine isn't working, it's time to evaluate for additional triggers and possibly escalate therapy. I typically tell my patients it's okay to try this, but if no improvement within 2 weeks, it's time to have a discussion on stepping up treatment. In terms of timing, research suggests evening dosing of antihistamines to be the best, since interestingly, nasal congestion follows a circadian rhythm and therefore is worst at night and in the early morning. Here are a few practical tips. Cetirizine, levocetirizine, these are moderately sedating, so it's reasonable to take these in the evening. Loratadine is minimally sedating and therefore can be taken at any time of day. That depends person to person. Fexofenadine, this is non-sedating, so timing matters less. Morning or evening is acceptable. Final note on antihistamines, if you're worried about the oral options, there are intranasal antihistamines available over the counter and represent another first-line treatment option. These work by locally blocking the H1 histamine receptors in the nasal lining, delivering the medicine directly to those inflamed nasal tissues, often providing faster relief. Oral montelukast, this is a prescription pill. It's not as effective as the others for rhinitis, but it can be helpful if you have both allergies and asthma. We've become more cautious about prescribing this because although it is generally well tolerated, it does have an FDA black box warning for rare but serious neuropsychiatric events, including suicidal thoughts and behavior changes. Finally, if none of this works, we look at immunotherapy. This is indicated for persistent and/or severe allergies and is the only treatment that actually retrains your immune system to stop the security alarm from going off. It is a 3 to 5 year commitment, but after this time, an average of 65% of people report reduction in their symptoms, with even upwards of 80 to 90% of people feeling long-term relief. The benefits of immunotherapy include less dependence on intranasal and oral therapies, and it may help prevent the development of new allergies and asthma. On that note, for those with asthma, if you find yourself reaching for your rescue inhaler more often during the season, that is atopic picture in action. Since allergies and asthma are both histamine driven, a bad allergy day often means a bad asthma day. If this is you, talk to your doctor, as you may benefit from a controller inhaler to better optimize the management of your asthma. On that final note, here's when you should speak with your doctor. Your symptoms significantly affect your sleep, work, or daily activities. Over-the-counter treatments are not providing adequate relief. You are unsure whether your symptoms are allergies or something else, like a sinus infection. You are interested in allergy testing or immunotherapy, or you're pregnant or planning to become pregnant and need guidance on safe treatments. I hope you found this information helpful here today. Subscribe so you don't miss part 2 next week, where we're going into the kitchen to talk about nutrition and natural remedies that are actually backed by science to help with seasonal allergies. Because at the end of the day, health should be simple. Here's to a week of high clarity and low pollen counts. Stay well.